Hey folks, it's Patriot Nurse. What should you never say to a doctor who is taking care of you? Anything you should avoid in particular when visiting a hospital or an office where medical providers are looking at you? Yes. There are definite things that you should avoid saying, and there are definite subject matters that you should broach very carefully when interacting with the medical industrial complex. We're going to talk about this today because there are major issues that are not getting talked about, and the potential for abuse and corruption by healthcare professionals is rampant, and we've seen it recently. We're going to unpack these issues today. Let's get started. So the first thing that we have to understand before we go over these do not touch areas, these subject matters, these things that you should never say to a physician or a healthcare provider, you have to understand that in the United States, most healthcare providers are under a mantle of obligation called mandatory reporting, meaning that effectively, if you see something, say something, or if you think you might have possibly seen something potentially, then say something. That's effectively the bearing that is being put on people who have licenses as healthcare providers. So what this creates is effectively a fear compliance system by the government, by the state boards, local boards, to force people into tattletelling on their patients. And this is something that's particularly disturbing because there's a major disparity in power with a patient coming to a healthcare provider seeking care at their most vulnerable times. There's no way that that patient can defend themselves against them for the most part. And because of the state of affairs, healthcare providers with licenses after their name and, nice, pretty starched white coats, they are looked at in many cases as effectively emissaries of God in our culture. That, a doctor would never lie. A doctor would never falsify information. A doctor would never utilize a patient's answers to enforce a political position or a point. So all of these things we know are obviously not true, that physicians are not God, that healthcare providers are human beings and they're flawed. And in many cases, they are driven by the same basal instincts that really have caused a lot of people to end up on the foul end of government enforcement over the years. So other things we're going to discuss, this is a mandatory prereq that you understand that in the same way that you would view yourself interacting with law enforcement as having a Fifth Amendment right to not say anything lest you incriminate yourself, you really need to apply that same mental filter whenever you are going and interacting with healthcare professionals, really in any case. Now, on one hand, I recognize that the healthcare professionals who are listening to this right now, many of them are probably nodding their heads like, yep. And then some of them are probably like, Patriot Nurse, how could you possibly disincentivize patients from reporting what's really on their hearts and what they're really struggling with? Listen, man, I'm here for my people. I'm here for my followers, my subscribers, and my patients. And they have rights, particularly rights to protect them against goons and thugs who have letters after their name, who happen to be government agents and political hacks with licenses. So that's where I'm holding. I care about people having their rights protected, including rights protected from the medical industrial complex ancestrously aligned with the government. So the first thing that you should be very aware of is any type of mental health questions, any type of questionnaire that would ask you if you've had a history of, for instance, mental illness, etc. Now, on one hand, if you are seeking care specifically from a licensed therapist or someone who you feel confident is going to help you get onto a path of better mental well-being, then that definitely is a need-to-know place. But be aware that if you are going into the medical system and you're receiving care and you check, for instance, that you have a history of depression, or you have a history of bipolar disorder, or you have a history of X, Y, and Z, then what you're doing is labeling yourself. And in many cases, if for instance, that you have seen remission or you have seen healing from these areas, there is no need to really, in most cases, there's no need to tattle on yourself. Now, again, I recognize that this is flying in the face of what a lot of the medical professionals who are alongside me would say. So we need a good history and physical. We need a good assessment. That good assessment is the basis. Listen, a patient has the right to tell you what they want to tell you. You don't have a right to force people to comply with extracting out their information. A patient has the right, they have sovereignty to give you the information about themselves that they wish, at the time that they wish, and only insofar as it benefits them. And if that patient has made the determination it doesn't benefit them, then they are not obligated to divulge sensitive parts of their past. So just a statement there of patients' rights advocates, that's what nurses do. That's what real nurses do. Real nurses do not abuse patient confidentiality and abuse patient trust. So as we've talked about the mental health part of things, let's also segue into another one. And this is number 2. This is firearms and weapons related things. 2 of the organizations that I despise the most in the United States have decided to advocate that their members conduct screenings for their patients' entry assessments on whether or not firearms are in the house. The American Academy of Pediatrics is one of them, and the American Medical Association is another. These are political hacks. These are political organizations masquerading as medical advocacy groups. But make no mistake, these people, in particular, the American Academy of Pediatrics, has really been a huge proponent of leftist policies, including gender transitioning and abusive mutilation of children. And of course, that's okay. But asking a person how many firearms is in the house, this is something that we should really advocate for as well, in their mind. The problem is this: when you've got this type of information, particularly in pediatrics admission assessments, the admission assessment is gathering information to determine, A, if there is a risk, a threat to the child. But the other thing is, depending on who it is who is seeing you, if they determine that there are firearms in the home, and they also determine that for whatever reason the kid says that they're sad, or that they don't get along with people at school, or, for instance, that mommy and daddy discipline them in corporal punishment ways that are commensurate with scriptural tenets, I would add, that they start to connect these things in their mind. Because remember, they're mandatory reporters, right? If you see something, say something. If you think there's a possibility for something. So be very wary about what it is that you respond to. And in fact, there is no need to know. They do not need to know what weapons are in the house. They do not need to know what firearms are in the house. You are not required to fill paperwork out. You can leave it blank. You can skip it. You can strike through it. You don't have to answer any of this. If they shove a tablet in your face when you go to the office, or they give you one of those little links that says, have this filled out before your visit, you still don't have to fill it out. And if they say, like for instance, if it gives you an error code, like you have to fill this out, like, none shall pass without filling it out. If it gives you one of those error codes, then just show up early, like 10, 15 minutes early to your appointment. Say, listen, I'm having some tech issues. I'm probably going to need a hard copy here or something else. And just refuse to answer that. You do not have to incriminate yourself. You do not have to give any information over to any healthcare provider, really any person, for any reason whatsoever that you don't feel comfortable doing. So don't do it. The third is specifically related to issues of parental dynamics in the house. And when it comes to parental dynamics, this can be not just for instance, pediatric visits, but also for really any type of interaction, particularly where family court is involved. And so family court, for those of you who've had the unfortunate experience of interacting with it, family court is effectively the single biggest way where the government takes mandatory custody control and otherwise purview over children. That is the biggest method, I think, overall for the transfer of power away from parents and into the state when it comes to the raising of children, is family court system. So if you can avoid family court by not getting divorced, then that would be a good thing. But also realize that whenever these dynamics show up, particularly in doctors' offices, it in many cases can end up lending itself to CPS calls. CPS is more likely to get involved, Child Protective Services. They are more likely to get involved in homes that are broken. So just be aware of how it is that you interact and what you say in front of doctors, particularly if there are children involved. The fourth thing that I want to discuss is specifically postpartum related issues to women who have given birth and also in pregnancy. Now, if you'll notice here, I have specifically chosen the biologically correct, factually accurate characterization of pregnant women. Because right now, one of the little trendy things that ACOG and the American Academy of Nurse Midwives, this trend right now is to call pregnant women pregnant people. Because apparently, like 0.1% of transgender people decide that they want to get knocked up later with whatever percentage, in it. None of this is relevant, right? The reality is that a pregnant woman is in a specific and vulnerable position, and we should advocate for pregnant women and their rights. Now, what happens is when women get shoved into the hospital model of pregnancy care and of delivery, they are put through a matrix of questions and really this gauntlet of things that they have to answer. And in particular, one of the things that you'll notice is that around the time of the third trimester and also postpartum, she will be given a question series to screen for postpartum depression. Now, be very careful about this. On one hand, I think it's fair to say, as a woman who has worked with other women in labor and delivery, I have also worked as a psych nurse, inpatient psychiatric, and I have also worked in postpartum care. So I've seen the whole gambit of this. One of the things that we need to be aware of is that there are certain, for instance, contributing factors to postpartum depression in women, and they should not be ignored. They should be mitigated, and they should be worked with appropriately in a caring manner and in an empathetic manner. But what happens is when women are given these screenings, these little numbers to add up, if you answer these questions incorrectly in your doctor's office, and you happen to have some activist nurse who's looking at it, or an activist doctor or a physician who's some leftist activist who really loves to get CPS involved in things, if a woman gives the wrong answer on her postpartum depression screening form, she could potentially look at a CPS call. This is awful. This is evil. Because when it comes right down to it, that woman is at an extremely vulnerable, if she is experiencing postpartum depression, she's in a very vulnerable position. And what happens is honesty is penalized. And whereas a woman, for instance, let's say that she was just struggling with baby blues, or she's just having a really hard time because she has no effective tribe, because the West has said, all right, women, you've cranked out babies, get back to work in 6 weeks and just, shove all of your maternal hormones down. Good luck trying to convalesce from all that. Your pelvic floor is probably going to suck for about 2 years, but you'll get over it. This is what we expect women to go through with no emotional support, and then wonder why they're depressed, and then send a CPS call to take their children whenever they actually reach out for help. It's abominable. It's deplorable. So if you are a woman, or you know someone who is in her later part of pregnancy and postpartum, I would just recommend to you, friends, that the best thing that you could do is to reach out and actually help. And not like, oh, I'll come over and hold the baby, but make food, do laundry, fold laundry, be willing to run errands, grocery haul, anything that you can do to practically help. Because when it comes right down to it, there are things that can pharmaceutically mitigate postpartum depression, but so much of this is hormonal, it is nutritional, and it is a lack of tribal support. And the last thing that a woman needs who is suffering from all of the aforementioned in deficit, the last thing that she needs is some agent of government knocking on her door, threatening to take her baby and her other children away. It's evil, evil things. And it happens, why? Because she honestly answers questions given to her by someone she trusts with letters after their name. Another thing that you should avoid saying like the plague is whatever you think is best. Oh, friend, let me tell you, whatever you think is best is like carte blanche for medical abuse. When you go into a hospital, and I've made videos about this particular, the hospital dark side, I'll put a link to that video up here. When you go into a hospital, unfortunately, because of the way things are, you really have to suspect that you are going to be on the defense, that people are going to be trying to intervene. They're going to be trying to give you things. They might be screwing up your medication. They might be not giving your family members the assessments that should be happening at regular intervals. They may not be bathing your family members in the times and care that are indicated for them. So when it comes to delegating your thought and giving away your critical analysis to someone because they've got letters after their name, friend, don't do that. Don't do that. Don't do that. When they ask, do you want to do this or do you want to do this? The thing that we should be thinking in our mind is, what questions do I need to be asking here? And is there any real pressing time need to finishing this decision process immediately? Delay, delay, delay. I'm telling you, delay, delay, delay. Take your time, take your breath. Because when, for instance, if you're being offered a procedure, being offered a drug, so much of your mind, particularly if you're not feeling well to begin with, and if you're in the hospital because you are not well, your mind is not operating the way it needs to because you're sick, because you're not at your best. Why in the world would we expect patients to be best at advocating for themselves and determining what's in their own best interest instantaneously, particularly if they've got a whole bunch of drugs on board? So you have to be able to give, this is a big important word, informed consent. And part of that informed consent is you saying, I'm going to take a step back here. As long as there's nothing emergent that has to be decided within 5 minutes, let me reflect on this and get back to you. So rather than trusting someone, say whatever you think is best, reflect on it yourself, take some time, simmer down, process it, and then make the decision that's in your best interest. Now, I know we've covered a lot of things today, but before we really wrap up, I want to drive a point home for you. No one is going to take better care of you than you. No one is going to take better care of you or your family than you are. No one is as vested in interest as you are. So what that means is, particularly in a time and in a place where we are in such dire straits from a lack of a moral compass and political division in the United States because of this lack of moral compass, when you are going into care, you really have to assume upon yourself the role of a secondary care provider for you or your family member. This is one of the reasons why I have created the online courses, the 4 and the 7 hour course, because that 4-hour course that I've made, the Foundations of Medical Prep, guys, if you invest the time and energy into taking that course, you are going to be in such a better position, A, to render care for yourself and to avoid having to go to see doctors and hospitals, etc. in the first place. But B, God forbid, should you actually need to go into care, you're going to be able to converse on a more equal level with these people so that they're not talking down to you and you're not exactly sure, wait a minute, what do they mean by that? What do those numbers mean? How did they get that? On what basis did they make this assessment? You're already going to have learned this stuff. So when you are interacting with them, you're now really narrowing that gap of a power deficit. You remember that power deficit that we talked about early? The more that you know, and the more that you're armed with knowledge, and the more that your skills are brought up to where they need to be, you are bringing that power back into yourself. You are reeling it back in. Woo, cast it away, reel it back in. So by reeling that power back into yourself, you're going to be in a place that you're not going to be as intimidated as easily. And you're going to make better decisions because you can stop and filter through that line of thinking. One of the things that I think is the most important about the work that I've done as a course facilitator and as an educator over the years, and I'll tell this to people in class, my goal is to teach you how to think. My goal is to teach you how to filter through the information that you're seeing and come to the best and most logical conclusions based on what you have learned and what you've found. So, plug there for the class. If you haven't taken that class, especially the 4-hour one, the Foundations Medical class, guys, for the price of that class, if it saves you 1 trip to the doctor, paid for itself, 2, now you're at a profit. But really, in the day that we live, I want to bring this back for a moment into some of the things that we've seen from a political standpoint. Guys, it has not been that long since Charlie Kirk was assassinated. And the things that we saw in the aftermath in the medical industry, doctors, nurses, physicians, healthcare providers, pharmacists, celebrating, reveling his death, wishing that people who followed him, conservatives, etc., receive the same. These people are sickos. They happen to be educated. They happen to have letters after their name. But make no mistake, they're not magnanimous. They are not some type of give love to the world, carte blanche. They happen to work in healthcare, usually because it pays for their mortgage and pays for their golf courses and pays for everything that they need. But they are every bit the bleeding heart radicals who hate you and me. And when you're going into care from people like this, you really have to be on your guard. And hopefully you're aware of these persuasions and you are making your choices with who you're receiving care from accordingly. Particularly when it comes to those people caring for your children, particularly when it comes to those people caring for your older family members, but also your primary care providers and your family physicians that you see. It is very important that you find people who are aligned with you on that. And if you can't, because I recognize a lot of people who, for instance, live in rural areas or people who have very limiting insurance plans, you may not be able to see the people that you like, to see the physicians, healthcare providers that you like. So if you are in that situation, my advice to you, hopefully that you'll have internalized after watching this video in totality. Remember your Fifth Amendment. The same way that you would interact with a policeman at a stop, you have a right to remain silent. And you don't have to tell anyone anything that you don't want to. I am not by any means advocating shirking care for people or that people should not seek medical care when they need. But what I am advocating for is to be zealous in guarding your information and to be very much proactive and on the defense when it comes to interacting with people who are in a power advantage over you and to whom you are giving very sensitive information. So be aware of this, friends. Unfortunately, because of the times that we live in, I don't see this getting better anytime soon, but what we can do is to shield ourselves and to take care of our family members and really to self-select out of this system. That is the reason for this channel. That is the reason for the classes that I have taught over the years. That is the reason for the mechanism and the teaching that I do in order to help people not have to jeopardize their safety and not have to put themselves and subjugate themselves into a system that really doesn't have their best interests at heart. If you got value out of this video, friends, please share this with one person who you know would benefit from it. One friend who you know, they might be in this situation. Share it, friends. We want to make sure that good people get this information and that they're shielded and protected from a potentially malevolent alliance between the government and healthcare informers who do not have their best interests at heart. Hope the video was a blessing to y'all. Have a wonderful week. For now, it's Patriot Nurse signing off, and I'll see y'all later. Bye.